Who pays first with employer coverage, and the Medicare 20-employee rule. Imagine you're over 65 and still working. You have health insurance through your employer, but you're also eligible for Medicare. Who pays first when you need medical care? That's what we're here to find out. The answer depends on how many people work for your employer. If your employer has 20 or more employees, your employer's health plan pays first. This means your employer coverage handles claims first, and Medicare steps in second. You can usually delay enrolling in Medicare Part B without penalties while you're still working and covered by your employer plan. But if your employer has fewer than 20 employees, Medicare becomes the primary payer. That means Medicare pays first, and your employer's insurance pays second. In this case, you need to enroll in Medicare Part B when you're eligible. If you don't, you risk gaps in coverage and possibly paying out of pocket for medical expenses. This rule is part of the Medicare Secondary Payer regulations. They help coordinate benefits between Medicare and employer coverage. It's important to understand because it affects your choices about when to enroll in Medicare. For people working past age 65, this rule can be a big help. If your employer has 20 or more employees, you can delay Medicare Part B enrollment while working and covered by your employer plan. That means you won't face late enrollment penalties. However, if your employer has fewer than 20 employees, you should enroll in Medicare Part B as soon as you're eligible. Waiting can lead to coverage gaps and extra costs. Some smaller employers might even help pay for Medicare Part B premiums, which can save you money. Employers with 20 or more employees cannot stop your health coverage just because you sign up for Medicare. They must continue providing coverage if you want it. But it's still smart to coordinate your enrollment timing to avoid penalties or gaps. So remember, if your employer has 20 or more employees, your employer coverage pays first. If fewer than 20, Medicare pays first. Knowing this helps you plan your coverage and avoid surprises. Whether you're working past 65 or planning your retirement, understanding this rule keeps your health coverage on track.